It can be pretty annoying to wake up with a stiff neck, but for some people, neck pain is chronic. It can come and go and even get aggravated by certain movements. But there are treatments that can help. Dr. Christina Captain is the lead practitioner for the Sarasota Center for Acupuncture and Nutrition, and she's here to explain. Great to see you.
Hey, good to be back.
What can cause neck pain?
Oh my goodness, so many things. I mean, really, it can happen acutely, like suddenly, if you're sleeping the wrong way. Changed your pillow for some reason, or had a long drive, or on a plane, you didn't have one of those cool neck pillows, and you're like, well, you know, you got up and you're like, oh my God, I can't even move. So that's the acute reason, right? But chronic pain is defined as over 3 months long.
Okay.
Right? So you've had it continuous for 3 months. Could it come from an injury? Absolutely. Could you have had a concussion 6 months before and now you have neck pain? For sure. I have a lady who fell off a bench backwards and had an extraordinary event and had all this neck pain, and nobody was like, oh no, you're fine, you're fine. But it really related to the concussion more than anything, the injury to the back of the head. You can have arthritis, osteoarthritis. It could be something like an old whiplash. It could be just chronic degenerative changes because we're aging.
Okay, so when someone comes with, you know, the explanation that it's sore, it's been sore, it's bothering me day in and day out, how do you look at, first of all, the cause and then decide a course of treatment?
So we love when patients already come with imaging, which is like X-ray, CT, MRI. So if they've already been down the route of seeing their primary care, they have a specialist, they've maybe even gone to physical therapy, and they haven't had any relief. Maybe they've already tried drugs, and their next place is pain management, and then they're going to have to get into epidurals and ablations and maybe surgery. And so they say, I don't want to do any of that. What can you do? That's why we love that patient when they come in, because we don't have to say, you need to go back and go through all of the work of doing this first. We'll treat you, but we want that to happen consecutively as we're working with you. And so, but that's my favorite patient, because then we're like, okay, let's do it. Let's see what we got. We already know the cause, and we can zero in on it, and no matter if it's stenosis, if it's osteoarthritis, if it's some kind of herniated disc, we gotcha.
So depending on, obviously, what the cause is, then looks at your course of treatment.
Exactly.
What are some of the options?
So we totally have acupuncture, of course. We're the Sarasota Center for Acupuncture, and we want people to think, when they're in Sarasota and they're thinking acupuncture, we want you to come to us. But why are we different, right? Because there's some 800 million acupuncturists, let's say. Not really, but a lot. Right? And there's other professionals practicing acupuncture as well. Well, first of all, we're very integrated. So we love to have physical therapy happening at the same time, or chiropractic, or even working with pain management if they're medically managed through drugs, or even if they're having injections, epidurals at a pain management physician's office. So we'd like to be integrated. We also want to know what your nutrition is. Like, how are you feeding your body? How are you sleeping? What are your ergonomics? Like, how do you have your posture? What are you doing with yourself? So all of those things matter. We're very different because of that. We're also different because we want you to know that we care about you and that there's hope. People come to me after years of pain, and they're like, no one can help me. I was just told I would have to live with it. I'd have to take medications. Now I have an ulcer. We want to help you with all of that, and we want to help you know that there's hope for you to get back to your lifestyle, play pickleball, pick up your grandkids, get on the floor, whatever it is, we want to help you. And surprisingly enough, this doesn't just happen to older folks. This happens to a lot of people in their 30s, 40s, 50s, and onward, of course.
Well, I think all of us certainly had an occasion of some bad pain, and for many people, it just lasts. You were kind enough to sit down and talk to one of your patients who has a really cool success story. Let's take a look.
I really couldn't even drive because I couldn't even turn my head. I really was at a loss. I had physical therapy, but to tell you the truth, it really did not help. Dr. Captain is just so earnestly caring about how you feel. I feel that my comfort is what the entire staff is focusing on. Dr. Captain means a pain-free future for my life.
And it doesn't get any better than being pain-free. What I love about that story, and really all of your stories, is even if somebody's coming in for something just neck-related, you're still asking and looking at everything, every part of the body.
Everything's connected, Stephanie. We can't just look at one piece and think it's not being affected by the other piece, or, you know, it's just all connected. We know, we see the whole person.
So it doesn't matter what's hurting, there is a way that it can be worked into a better feeling all around, and that is what Dr. Captain is all about. For more information, whether it's neck pain or anything else that you want to talk to Dr. Captain about, you can find her and her team by going to SCAN, that's the Sarasota Center for Acupuncture and Nutrition, SCANSRQ.com.